What advice do you have for prostate cancer patients about locating a clinical trial? Where can you find one?
Clinical trials tend to happen at the big cancer centers and the big academic university centers, although many of those programs will have affiliate partners out in the community. The easiest way to learn about clinical trials is to start by asking, the physician that's treating you for your prostate cancer. Oftentimes, they'll have resources and connections to the trials directly or the people who are administering them. However, other great sources are going to be patient advocacy networks. There are many of them for prostate cancer. There's one, there are several. I'll start naming a few. You have the Prostate Cancer Foundation. You have Us Too. You have Zero Cancer. You have FEN, the Prostate Health Education Network, which is an advocacy group for Black men with prostate cancer. So these are all great sources of finding out what clinical trials exist. And in addition, you can just get on the internet and Google if that's something you have access to. The trick is navigating all of the information. And I think knowing what trials are available for you, whether you qualify, that kind of thing can be difficult. And that's ultimately where finding a provider, whether it's your direct urologist or radiation oncologist or whoever is helping treat your prostate cancer, either them directly or sometimes seeking a second opinion and going to a place where you might find someone who has some expertise in trials, if that's something that you're interested in.
My father participated in a clinical trial. It was going on, I think, at the time of his treatment, and it was offered to us he was at a big facility here in Houston that asked him if he wanted to participate. We did a little research. We said we'd try it, and we were glad to be able to participate. I've participated in clinical trials also for different health conditions because I believe it's important that we have to participate in order for people to gather the information that's necessary. So thank you for that.
Absolutely. I think there are a lot of reasons that we think that our Black community, for instance, may not participate in a clinical trial, given the history of medical experimentation and various forms of abuse that have existed in our history. But what I recently heard from our community partners at FEN, when they surveyed Black men about prostate cancer clinical trials, was that although there was some concern about trust and the history, that the overwhelming majority of the men wanted to participate, but they never were asked, and that's really stuck with me. And I think that Black men are underrepresented in clinical trials, and we have to find ways to be more inclusive and understand what barriers might exist to participation, so that we can have that data to care better for the population.